Hey guys, it's me again, and back after my last treatment yesterday morning, and I had full intention of trying to come home and do my vlog right afterwards so you guys could kind of see what I was like right afterwards, but that just didn't happen for a couple different reasons. My wife worked the night before, so I got my own ride to treatment. I took an Uber. And the hospital, being that I'm coming out of general anesthesia, they have requirements for how I get home. So they actually took me home, which is nice. And yesterday's treatment was just different. I had a different doctor. It's actually the doctor that I met with in the first place. Reminds me much of my doctor back in California. Very knowledgeable. He's on the older side, semi-retired, but just has a vast knowledge of it. And so the doctor who had been treating me here just basically had gotten the first doctor's notes and was just treating me per treatment, and we were going from there. And that's, we'd been doing the propofol, which gets along with me really well. I have a good recovery time with that. And he was pleased with my seizures. First doctor comes back yesterday, and he was not entirely pleased with my seizures. He felt that we could get better results if they were a little bit longer. And he said one of the problems with propofol is that it decreases the length of the seizure. And so we decreased the propofol. Wasn't a big fan of that. Still had the Versed. I can't tell you everything else that they gave me because I didn't even recognize some of the medication names. One of them he mentioned, and I had never heard the name of this medication. I can't even pretend to tell you what it was. He said that it was administered for asthma, if needed. And when he administered it in my IV, it was very bizarre for a couple reasons. He injected it into the line, then pulled out, then pushed back in. It was, I don't know if he was trying to dilute it. I don't know what procedure that is. I haven't talked to my wife about it and seen when that's done. She's a nurse, so she would know. It's just the first time it's happened to me. But the sensation I got from that going in was in my lungs and in my neck and in my head, in my nasal cavity. It was spicy. It was a spicy, peppery feeling. I've not had something like that before. I'm not entirely sure what the reasoning was behind that. We did talk for a while about other things, but when it came down to the actual administration of the medications, I'm not a doctor. I'm not part of the medical staff, so I'm only privy to a certain amount of information, and I only had a limited window to ask certain questions. So that was an interesting experience, and shortly thereafter I was put under with propofol. And then I'm sure there was something else that helped since they lowered the propofol. And then I woke up. I think I woke up pretty quickly, like I have been with the propofol. But I was wiped. Unlike with the propofol and the ketamine, that's another thing they changed. I don't believe they gave me the ketamine yesterday because the ketamine is used to induce a better seizure without the propofol. I don't necessarily need the ketamine. but I was kind of hoping the ketamine was going to be used as a secondary measure to help boost acute antidepressant effects. I felt that it kind of had been, so no ketamine. Like I say, I woke up and I really couldn't sleep. Once, I don't know, it just depends. If you're zonked enough, it's easy to sleep in a hospital setting. But if you have other beds going on around you, if you have nurses running around, it's not the easiest thing to do, even if you're just exhausted. So they gave me some water, kept checking up on me. They brought me some lunch since I was going to be, well, I got out of my procedure about 11:30, and the bus didn't arrive, well, the van didn't arrive to get me till 1 o'clock. So I was there for a while, just languishing in bed, and so they got me lunch. It's great staff there, really is. Really caring, know what they're doing, and so I don't know how to properly describe it, but I was just exhausted. I had a major headache, kind of be expected. Sometimes I just was having trouble thinking straight. I could, it was just a bit of work. So when I got home, I ended up sleeping. Like I say, I kind of wanted to come home and do some videoing of me, but I just wasn't up to it. Didn't want y'all to see how zonked I was. Just wasn't ready to present that out there. But I did come home, and I went looking for a cup in my kitchen and couldn't find it. And that's where the memory issues come in. Every single time I go in there, I have to fill out a questionnaire that there's basically 3 different questionnaires. One is, how likely am I to try and kill myself at this moment? That tells them how dangerous I am. Am I going to, not only am I improving or going backwards, but do I need to be hospitalized? Second one is more detailed of indicators of depression, so am I improving or not? And then last of all, they do a little questionnaire on memory issues. And because they are concerned about memory issues, they're not sticking their head in the sand. This is a real reality of ECT, dependent on the person and the treatment. And so yesterday I came home and I was starting to question, okay, thinking back, talking to people, did I already tell you this? No. Okay, good, because I thought I had, and I was worried I was going to be repetitive. Just starting to get a little bit of a walk back to 2015 when I was having lots of memory issues, and I'm not willing to do that again. Let's just say that. I don't have time to do that. I have a family, school, working on getting a job. Just cannot go back to that time. But, so I had my last treatment for now, Thursday. That's the last treatment I'm approved for through insurance. And then I'm going to head out on vacation for about a week and a half. So I'll have a week and a half for my mind to clear up. But I don't know which doctor is going to be in on Thursday, but I'm definitely going to talk about going back to the propofol with ketamine. I was pleased with the results, and if I'm going to have these results each time, I'm going to quit treatment. So I know that it can't be the first time they've heard that, and it's just the reality of it. The doctor was inquisitive, asked if I felt the treatment was working, and I said yes. But the difficulty in that is I have to stop certain of my medications for 24 hours prior to treatment because they changed the threshold of seizure. And so if I have certain medications that either make the seizure come on more quickly or not as quickly or last longer or have a shorter duration, all those can affect my treatment. So in order to make sure they don't, I have to abstain from them to make sure that they clear from my system before they administer the medications they want to take hold. So I said, when I have 2-3 treatments in a week, that means I'm missing 3 days worth of medications, and some of them have a real effect if I miss them for 1 day. So trying to distinguish between what is a downside from missing medications versus an upside of ECT, it's difficult to say. But I will say this, I've been in a more upbeat mood. I've generally, except for this last 24 hours because I've been wiped out, I've been happier. I went in to see my therapist, sadly, for the last time last week because she's moving to England, so I have to get a new therapist. And pretty much since I see her once a month, she has me do a digital follow-up quiz. It's like 60 questions, and it kind of assesses depression, suicidality, if that's a word, different things like that, anxiety. So it measures several different things. And she showed me the graph over time from last summer to this summer, and the one I just filled out the other day showed me, I think, the best indication on every single metric that the test covered. I was not very suicidal at all. The thoughts have not been oppressive. I've been generally happy and upbeat. Body image hasn't really changed over the duration. I'm still struggling with weight. I'm overweight. It sucks. And it's a big struggle I have. That's one of the things that deals with the depression. It makes me depressed. That's a real thing. That's just not in my mind. But the metrics were looking really good. She showed them to me and she was so happy. She gave me a high five. I think she was pretty pleased with being able to leave it at that and head out because I was, from what I gathered, probably one of her bigger at-risk patients. Because originally, I talked about getting another therapist at the university. And she said she was one of the senior clinicians, and unfortunately most of the other therapists had less experience and would probably be a bit intimidated by how high risk I am. I know that sounds kind of funny. Sounds kind of stupid, actually. But I understand, because I had a couple crises during the year where I really needed help and I almost needed to be inpatient. And she was there and she helped. But now that I feel more stable, she said she was pretty sure she could pair me up with a new therapist at the school, and that I would have that resource. I love having a therapist at the university because it's right there. I don't have to drive somewhere else. I just walk across campus, talk to them, get a plan for the next month, and get going. So I know I got a little bit off track for this, but the ECT is working. I just had a bad treatment the other day. This is the kind of treatment that if we kept it going up, maybe it would be helping my brain. Maybe it's stimulating that neurogenesis in the hippocampus and doing other things to remap in a positive fashion. However, the memory issues and just the general feeling of just feeling ill detracts from all that and takes it away. So in the end, you have a net sum of 0. Or in the fact of 2015, I was having such bad memory issues that it was actually bringing the depression on harder. So that's when I spoke to my doctor and I said, we gotta back this off. We gotta start weaning me off of this, because for whatever positive effect the ECT is having, it's detracting from it. The memory loss is detracting from it, and it's actually making my depression worse. So there's a balancing act there. And Thursday we will talk to my doctor again and see how that works out. Now, no promises, but I'm going to try and get on that morning after my treatment, if it's not a big zonker, and do my vlog. It'll be the earliest appointment I've had so far. We're going to go in at 6:30 and try and be one of the first couple in and out. So then we'll be back at home, hopefully before 10, and I can just report in. All right, everybody. Thanks.